I'm incredibly fortunate that none of my family or close friends have succumbed to the coronavirus. But the pandemic is a very real situation when you are a frontline healthcare worker like me. As a radiology tech working at a large medical center, I care for patients on a daily basis who have tested positive for the coronavirus, and I am one of the first points of contact for patients suspected of being infected. At least a dozen times during a 12-hour shift, I put on an N95 mask, a bright yellow gown, and gloves so that I can safely deliver the high-quality care that my patients expect and deserve. I got into medicine to care for patients. As a healthcare worker, I bear witness to a broad spectrum of suffering, the kind that we are all likely to face at some point during our lives. But what haunts me at the end of each shift is the pain that could have been prevented if patients who are uninsured or underinsured had been able to access care sooner. Well before we ever heard of COVID-19, frontline healthcare workers were well aware that our healthcare system routinely undermines caregivers' ability to treat their patients while maintaining their own safety. As we rapidly approach 300,000 deaths from COVID-19, it is important to recall that an additional 250,000 Americans will die this year from medical errors alone. I would argue that most of those deaths are at least in part because of our ineffective and multi-tiered healthcare system. The American healthcare system is unique among the so-called developed world for being unnecessarily complicated by market interests. In the United States, care is rationed, care is duplicated. For millions of people, care is never received at all. Suffering from COVID-19 has not been limited to patients. Our dysfunctional system frustrates clinicians and frontline workers like myself who have a front row seat to the cruel madness of American medicine. As one physician put it, it's like I'm fighting with one hand tied behind my back. So while the scope and severity of the COVID-19 pandemic may be unfathomable, the challenges facing healthcare workers right now, like safe staffing ratios and access to basic supplies and personal protective equipment, are not markedly different from any other day of the week. When frontline healthcare workers don't get the things they need to do their jobs, people die. An estimated 1,425 frontline healthcare workers may have died from COVID-19 so far. It might come as a surprise to the majority of the American public, but healthcare workers, who are among the most at risk for contracting COVID-19, are currently not guaranteed access to medical treatment. A 2009 study found that 11% of American healthcare workers are uninsured. Think about that for a moment. That's 1 in 8 caregivers who could be treating coronavirus patients right now. I was one of those workers without health insurance. I had an associate's degree and a certification, but no coverage, and still expected to expose myself to highly infectious agents like MRSA, HIV/AIDS, and tuberculosis. That sounds preposterous, but it is not the exception, but quickly becoming the rule at the large medical centers that are currently fighting to monopolize healthcare delivery in our communities. Even if employers provide health insurance, some workers' low wages prevent them from purchasing coverage. A publicly funded, single-payer healthcare program like Medicare for All, however, would ensure our universal need for healthcare. Not only would Medicare for All increase the health of every American, and it would be a big step in lifting healthcare workers out of poverty because the money that employers spend on providing health insurance could be shifted to raise wages. It would be life-changing for the estimated 1.7 million female healthcare workers and their children living in poverty. The staggering complexity of our healthcare system requires a tremendous number of administrative staff and resources, which account for a whopping 25% of all U.S. healthcare expenditures. Consider Duke Medical Center, which has 1,600 billing clerks, but only 957 hospital beds. Yes, Medicare for All will eliminate around 1.8 administrative jobs, but in turn lead to the demand for 2.3 million full-time healthcare workers to accommodate the millions of patients newly eligible to receive care. This will help ensure that caregivers have the staffing levels they need to safely and swiftly respond to public health crises like COVID-19 and beyond. Medicare for All would also give a boost to healthcare workers who want to unionize over unsafe staffing levels and a lack of basic supplies, because hospitals would be barred from using public money to bankroll union-busting campaigns. In fact, many of the groups that have linked rights in the workplace with the health of their patients have been nurses and healthcare unions. In order to effectively care for our patients, We need to implement a healthcare system that meets the needs of everyone and allows caregivers to do their jobs without the intrusion of hospital administrators or private health insurance company executives. We know what we need: Medicare for all. How are we going to get it? It's going to take a mass movement of essential workers, teachers, small business owners, and patients. It begins with us recognizing our human right to health care and the realization that collective problems require collective answers. Thank you.